Assalamu alaikum. Good afternoon. Thank you for having me today. Special thanks for the organizing committee, scientific committee, and also special thank, and I would like to take it at the stage for Prof. Majid. He was a great leader to us previously. I'll start with just setting the stage about what's the Saudi Health Council. Basically, some of you are from outside the country, and some of our physicians have been interacted with the council for a limited journey. So the council basically started in 2002, 20 years back, with a vision that to establish an inspiring reference for a world-class Saudi health system, and with a mission to establish regulatory that ensures coordination and integration between different stakeholders. Now, as you can see, we have a very powerful and strong mandate that usually support the system to improve and move forward. So what we do at the Saudi Health Council, we set up strategies for the national health direction. We also do integration policies and implementation and programs monitoring. We evaluate policies that have been done. Also, at the council, we review some legislations that can promote healthcare and introduce it to the Royal Court for improvement and changes. Also, on the other hand, we support in creating some national committees that support in solving different challenges in the system and trying to come up with different solutions. Now, if you look into the council itself, there is different members of the private sector, public sector, military, civilians also. And then you look into the health sector allies, like, for example, Ministry of Finance, Ministry of Economic and Planning, Ministry of Human Resources and Social Affairs. All of these are part of the healthcare planning. You need them when you plan. We need them when you direct your services. I just want to show you the national centers that we have. So we have like 10 national centers. Saudi Center for Accreditation of Health Services and Institute. It's similar to GCI, but it's locally in Saudi. We have the National Center for Organ Transplant, Patient Safety Center, National Heart Center, National Diabetic Center, also the National Center for Evidence-Based Medicine, which we'll talk about it also, the National Center for Growth and Development Disorders, and also research, also the National Center for Cancer, National Information Our Health Center. The ones that I selected on blue squares, basically these we think that are potential interaction with you guys and the committee or and experts who deals with IBD. Because you will have a lot of things in common to the system and to introduce to the system. Now, if we have a zoom out on the new transformation program, some of our colleagues from outside the kingdom, we'll give them just an overview. So it started with the goals, with having a vibrant society, thriving economy, and ambitious nation. If you look into it, there is three zones or three levels of strategic objectives. Our transformation focus basically on level 3, which is facilitating access, improving quality of care and efficiency to healthcare services, promoting prevention and risk prevention, and also enhancing traffic road accidents. Now, these come from challenges that we faced previously. So if you look into the average annual death rate from premature death rates, we have around 90,000, and we're behind in 2016 from most of the G20. So we're lacking around 5.2 years behind them. Now, the recent published life expectancy, we are above the average of the G20, which is thanks to the transformation efforts that has been captured. Also, in 2016, we had 4.6 million of diabetes patients registered, and this is expected to double by 2030, and that's an extra burden to the system. Growing population that will also have a burden to the system. So all of these come with a cost. Now, the other thing is the governance of the system. So our system basically is multifaceted. Every organization has sometimes mandates that overlap. So now the transformation comes with a structure that they want to correct these things. High death rates from road traffic injuries. In 2017, we used to be the last in the G20. Nowadays, with the interventions, legislations that have been introduced, cameras, safety belts, we came next to the average of G20. Also looking into the overlapping regulator function. So basically, Ministry of Health does provision, does payment, and also regulation. So all of these has a conflict of interest. So that's why we will see that it's completely has different, and we see now a new payer. Duplication of health services by providers. So we have patients are double tapping in the system. So they can go to private insurance, they can go to different governmental sectors. And that's a challenge and a cost by itself. And also supply and demand. Dr. Majid was just earlier mentioning that we need the new forces or new workforce that can accommodate the needs for the future. And these are basically the contributors, like having fragmented health services between primary and secondary, lack of infrastructure and IT, and others. Now, these are the domains that the public policy will cover. Basically looks into the risks and security. So we have a complete pillar around that. Health financing is another issue, how we can move from line item budget into capitated future-wise. Value-based health innovation. We started last week. We had a biotech workshop, just looking into innovation and supporting it. Looking into also health and health policy. Now, currently, we have a new established council for health and health policy that is also chaired by members from all ministries, and also higher representation from ministers. We have also looking to improve the value base and the workforce enablement, and finally the road traffic accident. So this is the 8 structural branches of strategy where most of the initiatives are located around them. So you can also look into these and also think how you can design from IBD perspective committee or a community, how can we link to these future-wise? Now, the whole concept comes around the evolution of a new model of care. The new model of care comes into, it's in the center, but it needs a lot of enablers, which is basically corporatization, where we can see now the health holding companies and the ACO, Accountable Care Organization. Governance model need to be also changed. Payer, now we start to see the Central National Health Insurance, the CNHI. Private sector, how do we can contribute to them? PPP, Dr. Majid showed us in a while the home care concept, so how can we bridge that also to private sector, how can we collaborate with them? Workforce, it's also a challenge, and we saw that obviously with COVID-19, with the stretched resources, and how can we locally help it? Then the digital transformation, which we'll be talking about it shortly. Now, this is the mindset that what has changed. So previously, we used to work into hospital base. We need to go to more of a home care base or a community base. We used to look into activity-based outputs rather than outcomes of the patient. So we can produce numbers of patients, but without the guaranteed or the wanted desired outcomes. From treatment-based into prevention, from also institutional to more of an integrated. So we used to have more of a fragmented system. Each level of care talk in separation with the other. We also recently saw the first and the largest hospital, the digital hospital. So we're moving from physical buildings toward more digital, and also toward more integration, and how we can activate the participant, which is the patient. How do they enable them? So the digital file or the unified file is one of the pillars. You'll start to see digital solutions now in the future with Sahati. So how do you enable patients, and how you as a community can plug there and help them? Now, this is just to show you what happened with the model. So the MOH used to provide purchase service and also to regulate the service. This now doesn't happen anymore with the new mandate for the health holding company and the CNHI. So we saw that the Ministry of Health will be just regulating. CNHI will be responsible for purchasing healthcare services, and the cluster to deliver the health services, and all around the beneficiary. And this is basically structured around something called the triple aim, which is patient experience, population health, and cost, reducing cost for healthcare. This is an overarching for you just to understand what is the health holding company. So it's basically a company that will own the assets of the hospitals in the kingdom, especially MOH hospitals. They will have business units. These business units will help the acceleration and facilitate the transformation of the clusters. We're basically located in 5 regions. And then we have 21 clusters that will be launched across the kingdom with advisory board that can help and facilitate. They will be accountable for the integration of care, the service delivery, and the outcomes of the patient. And this is what we desire, that we have a care that will look into value, deliver value, and it's a patient-centric. So what do we mean by that? Our model of care will be something that we can export outside the kingdom. It's a state of art. Also, we have a transparency on data and visualization, incentivizing good outcomes, and also controlling the costs in a way or another. When it comes to patient-centric, we're looking into having design the services around the patient. We start to see a movement around population health needs, surveys around reaching out to communities, enabling patient groups, communicating their voice. Also activating the patient by choosing their providers down the road, so they can choose between public or a private provider. But that will need a journey to go there, to reach there, a maturity of the system. Now, on the left side, you can see the patient is in the center. Usually, he has to figure out himself. So no case coordinators. He has to move between each department, trying to figure out what's next for him. And there is no home care activated. So you can see what we call it the flower, or basically it shows the different levels of care, from primary care to virtual care to specialized care. And then right side, you can see the wanted or the desired outcome from the system. So you can integrate home health care, you can integrate the unified medical record. All of the providers comes to serve the patient, so the patient is in the center. And how we also enable primary health care as a gatekeeper for them to reach out. This is in a way how the pathways. So you can see there is a standardized 10 pathways that looks into structured for main KPIs. They look into structural outcome and also process. Now there is another 200 pathways. So these pathways usually customized based on the level of care, based on the maturity of the cluster. And I urge you also as a community to look into your pathways. How do you connect it? How do you communicate it? Because this is really going to have an impact on your patients. And what KPIs can we plug in? And basically, this is an iterative process. So we go and improve as you go. Each one of you will have a different setup based on their hospital and their level of care. Now, someone will ask, why did we choose this pathway? Basically, this is based on the calculation of life saved from total death. The priority came from stroke, STEMI, breast cancer, and colon cancer. And to show the way that how the system become more transparent, they start to put targets and numbers. So you can see that the target of 2022, we reached around only 70% on colon cancer. And the other way, also breast cancer, 73%. And that's the way how the system gonna be. And you can see it across even different providers in the system. This is just to show you what the direction of the HSTP looking for to achieve. So when you talk about workforce, we saw the ratios that just presented earlier with Dr. Majid. So what would be a standard productivity? That's a challenge because you need to link it with also your financial incentives. How would you set up the targets? How do you work for work plans? Some of you have problems in asking for more staff. How you justify it? So you need to look at this from a service delivery point of view. Also, there is a lot of initiatives, which is specialization like IBD needs to return some of their staff. How can you think about it in a joint with the transformational program? Increasing the number of Saudization is also a priority nowadays in the country. This is one pillar that is really a priority, and we need to, together we can work around it. Also in digital transformation. So how do you enable quality and standardization? You will start to have Saudi Patient Center putting standards, KPIs. How can we enable it? Also patient tools that can help your patient be proactive instead of reactive coming to your clinic. How do you educate them? How do you really activate them? ensuring effectiveness of operation and monitoring it. Basically now there will be a complete monitoring of assets, workforce, and better planning. And that also experts from your side need to be available in these committees. So what are we missing? So I did a little bit literature review, so to see what do we have and what can we bring to the table together. So I couldn't find really some policies around different domains. So we show you the different 10 domains, the transformation looking at it. We didn't see really policies touching any of these. Even we can start with some policy brief. Basically, you raise the concern. So what do we want? What do we want from policymakers to look at, and they start to communicate it and institutionalize it? I'll give you an example. Home health care was not covered by insurance. And with the push from the Saudi Health Council and with the community of home health care, we start to see some services has been covered. I think one of the good opportunities, for example, the STEP approach, Dr. Majid's approach, how can we look at it? Can we push the agenda for that? Other thing is the burden of disease. Basically, you will ask for funds. And if you don't have a clear burden of disease, clear epidemiological studies, you cannot negotiate that basically with policymakers. And also, you have to anticipate the growth for 2030 population. Clinical pathways. We have in the Saudi Health Council with evidence-based center. And I think you could, as a community, approach them and look at collaboration in terms of localizing and make it a national level clinical pathways. And you can take it also into digitalization, because now health holding companies and others started to plug these into their systems. We recently, last month, saw the the Saudi National Institute for Health. It's a wonderful place to start with for your research. They have a huge funds. I urge you all to go and apply for it. It's very, very, very attractive area to start with. In terms of digital health registries, all the registries are coming from the Saudi Health Council. I think that's an area where you can also look at, click in it, and also start to create some needs for your community or your patients. This is just something that we created at the council. We finished last year, a manual, how do you create policies for different domains. So basically it goes with you step by step. And if anyone is interested, we can share it and communicate this with you. And this is the ongoing policy brief. So we're working with the community for the Heart Association community to create policies around valvular heart disease, performance-based incentive, rare disease. We have a community and we started to work with them to initiate some policy briefs. And also we're urging you to come and work on policies related to IBD. And with that, I conclude. Thank you very much.